Maza is a network of motorized tricycles in remote rural areas of Ghana that provide transportation for people in need of urgent healthcare to the hospital, to the health center. Our focus is on pregnant women and infants because the data show that they are the most vulnerable in terms of timely access to care. And the way it works is that we have, currently we have 13 drivers, 13 motorized tricycles in remote areas at the community level. These drivers are available on a duty roster schedule every third or fourth day they have duty for urgent healthcare transportation. We also have a toll-free number that people can call using their mobile phone, and the dispatcher picks up the call, goes through a list to find out who the driver is on duty for that day, activates that driver, goes to the person's home, picks them up and takes them to the hospital. We have it set up such that when the drivers are not on duty, they are able to use the vehicle for commercial transportation, like taking people to markets, traders, or getting goods from people's farms, which is a very important part of life in rural areas in Ghana. So Maza launched in 2015. We registered in April 2015. We spent some time planning, designing with the community members in the rural areas with Ghana Health Service, Ghana Ambulance Service, and the Catholic Health Service. And then we launched in December 2015 in Tripoli district, which is in the northern region of Ghana. Tripoli has a relatively small population, about 53,400 people, so about 45,000 of those people are rural. And the way we designed it is that we got roughly 3 vehicles per 10,000 people. We calculated it based on population density. In the rural areas, the challenge people have accessing healthcare on time is that the distances are vast, transportation is very scarce, especially motorized transportation, and the road network is limited. So if someone is sick and needs to get to the hospital urgently and they go on foot, it could take them 4 or 5 hours. If they go on a bicycle, maybe 3 hours. Motorbike could be maybe 2 hours or so. Challenge is that when you're a woman in labor, you don't want to sit on a motorbike. So the Maza vehicles are motorized tricycles with passenger benches, and we had it set up so that women can sit or even lie down. We've been in operations now for 3 months. About half of the people who use our services right now are pregnant women in labor or women who delivered at home who've had complication or sick infants. Roughly 40% or so of people have not been either pregnant or infants, just regular people who have some urgent healthcare situation like an accident or care in their house. As I started essentially on a shoestring budget. We did the research, we understood the challenges, we came up with potential solutions, and we wanted to demonstrate the viability of the model, get information from the users, the drivers as quickly as possible so we can keep improving the model, and use those data from the first few months to then convince people to give us funding to do more, scale up to other districts in Ghana. So right now we're actively fundraising. We've been fundraising actually for over a year. We're still fundraising. We've had some success with crowdfunding platforms. We're exploring additional crowdfunding platforms. We're also applying for grants, fellowships, all kinds of opportunities to try and strengthen the work we're doing in Tripoli district, learn as quickly as possible so we can scale up to other districts in northern Ghana initially that need our services. We do have a vision for more than northern Ghana. In the southern part of Ghana, there are areas with communities that are cut off from their nearest clinic by water bodies, rivers, lakes, streams, and we need to figure out a way to improve access, again, timely access to healthcare in the case of an emergency or a woman in labor. And then our vision beyond water transport is air transport in maybe 5 or 6 years' time. This problem of access to healthcare in rural areas is a challenge, not just in Ghana, but in other sub-Saharan African countries. Once we've figured out how to do it right in Ghana, we hope to scale up to other countries in sub-Saharan Africa.